Good morning, everyone. Lots going on as usual, and really, there's a whole bunch going on. It's the weekend, but it doesn't matter. Here is Senator Denise Batters, and she said in his press conference today, not a single reporter asked Prime Minister Trudeau about his government's assisted suicide for mental illness scheme. Get it together, Canadian media. Canadians are not even aware of this massive and dangerous change with Bill C7. And yeah, I mean, it's interesting the lack of interest from Canadian media. Instead, they report breathlessly, oh, Facebook, oh my goodness, Mark Zuckerberg has been summoned to testify before Commons Heritage Committee, right? And so this is a great story. People are like, yeah, we'll get that Zuckerberg. He's going to pay for our news or whatever. I think he'll just turn off linking to news on Facebook and say, haha, Canadian government, not going to happen. Because the reality is he's been asked to come to Canada before, multiple times before, actually. Hold on. This article was showing. Okay, Canadian lawmakers irritated by Zuckerberg's snub issue summons. This was 2019. May 2019. And while I was doing the research on this story, I looked up Zuckerberg called to House of Commons, and I found that this one, right, the article I just showed you from today, that the CP24 is saying that he's been summoned. He snubbed the UK Parliament previously in 2018, and he's snubbed Canada's Parliament twice before in 2019. So yeah, I'm not holding my breath, but it's interesting that the Canadian press isn't really interested in actually a substantive story that has meat to it. No. Let's focus on Mark Zuckerberg being called by a committee. He's not going to show, and nothing's going to happen. So, it's a meaningless story, just meant to drive clicks. Ooh, Facebook, right? Laura Stone says, breaking. Paul Calandra says, Ford Nation called the MP, and I can't remember their name, Sol Memekwa, sorry if I got that wrong, who flew into the remote Indigenous community and got his vaccine. The PCs called them out yesterday, and then they said, I was invited by elders to combat vaccine hesitancy in this region, and Ford was called on by other party leaders to apologize, and I said, he's going to apologize. He's definitely going to apologize. He apologized. Now people are saying he has to apologize publicly. You accused him publicly. You have to apologize publicly. Oh, well. Interesting. We've still got a pastor in jail in Alberta because he refuses to turn away people who want him to continue to preach to them, and because of that, he's in jail. However, Jim Murphy says, meanwhile, a pastor in Alberta can't get bail. Am I the only one who sees a problem here? The Liberals have this all wrong. Target criminals like this guy and leave law-abiding citizens alone. Peel cops keep catching the suspect, but courts keep releasing him. He's 23. He has multiple gun offenses, and they just keep granting him bail. So yeah, it's really interesting, like the juxtaposition, right? Like on one hand, people are saying rule of law, and we want to combat violence and crime and gun violence by cracking down on these things and creating laws around it. But at the same time, the laws that we have aren't being enforced in certain situations, and laws that we don't have are being enforced in other situations. So it seems really disingenuous to have a government that is, it seems like walking around a room with a paper bag over their head saying we're solving all the room's problems. It's like you're not even in the same realm as the rest of us, man. Like you're not in the same ballpark. Forget about solving the room's problem. And this is a bad analogy, but it feels like they're lost and trying to lead the way. It feels and trying to convince us that they know how to solve this problem when their actions are proving that they don't. So, and proving that they don't in a way that is actually making it actively worse. The crap that they're pushing is making the problem worse, and they're saying, "Follow me, gents. I know the way off this cliff." And, they walk off the cliff, but it's unfortunate for the people who follow them, right? And Canada is forced to be following these dolts. These dolts. Catherine McKenna announces $400 million for bike paths and trails. Oh yeah? Where's the budget? $400 million for bike paths. We live in Canada. We have roads. Aren't bike paths like a municipality thing? Why is the federal government, who is racked with like military scandal. We'll get to that. Racked with spending scandal. We've got the most unemployment in the G7 with the highest cost for recovery. What recovery? Our businesses in Toronto are still closed. The most locked down jurisdiction in North America. And these guys, without a budget, are saying, good news, everyone. We've got money for municipalities to put bike lanes in. You're welcome. We know where we're going. We can solve this problem, says the Liberals. Just follow those guys. Wow, right? Christia Freeland says, today the government announced federal funding for cycling paths and trails across the country. This funding over the next 5 years will help build new and expanded network of pathways, bike lanes, and trails and pedestrian bridges while helping create jobs and healthier communities too. You have $400 million for bike lanes, but nothing for drinking water, vets, and seniors. Where did you come up with $400 million when you don't have a budget? These simple questions from the plebs, right? Like from the cheap seats. Where did you get the $400 million from? Here is a dedicated fund for active transportation. It's the same stuff, right? I'm sure First Nations will enjoy riding the electric bus to get their drinking water, says Rex Glacier. Savage. Waterloo Region Guelph leaders meeting with federal minister to discuss new firearms legislation. I don't support the federal government sidestepping the provincial authority and handing powers like this to municipal governments who are activist in nature. And if you listen to the delegates at City Hall, etc., I have, and it is, people are passionate, and I don't want to paint anybody with like one brush. Like there's all sorts of delegates, people who are very knowledgeable about how housing gets built, people who are very knowledgeable about stormwater retention, people who are knowledgeable about the electric grid and the negative impacts of making all cars EV, right? Like we can't keep the lights on in the summertime with all the air conditioners on. So you want to charge everybody's car at home? What? Like, use your head, man. But regardless, I don't think this is a good idea. I don't think this meaningfully impacts anything with regards to drug crime, gun crime, gang crime, or anything like that. I think it's a paper tiger, right? It's meant to make the mayors look good. It's meant to make the federal government look good. We're having meetings. We're doing things. Look, the public can see us having meetings and doing things. We don't know why the crime continues to go up. We don't know why there are continued problems. We don't know why fentanyl keeps killing people in higher numbers than COVID-19. We're not sure. We can't solve these problems, but follow us, right? And it's frustrating, right? Handing these powers over to, I was saying delegates are activists. There are some delegates who are activists. I've seen delegates who have delegated every city council meeting, and they do the same shtick. And so the people who are leading us, the people in municipal governments, aren't easily swayed. But people who want the potholes fixed don't have time to put together a 10-minute presentation about why they want the potholes fixed. They figure that's basic, right? They figure that's like, get the potholes fixed, make sure the city can run properly, and then maybe let's fund bike lanes, right? Like maybe then let's fund the extra stuff. But first, let's take care of the basic stuff first, right? And that's what people think. But what actually happens is the activist people worm their way in, and they stage protests, and they have resources. They're organized. Whereas the people who are like, just leave us alone and make sure the roads work, they don't have an organization saying, listen, like, you guys understand your responsibility is to make sure the roads work, right? Because the people who are pushing are saying, we need equity. We need road equity or something, whatever equity thing that they're on, whatever drum they're banging, it doesn't matter. Whatever's the buzzword of the week, they're going to demand it. And the people who are in those positions are being pushed because the social media stuff looks like those things are being demanded by a lot of people. The social media is threatening their re-election, right? Blah, 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 all of that stuff. There's influencing factors. And I fear that the people who really just want to be left alone and have the roads work are not represented. And the people who are being forced and given extra powers to make decisions are not well insulated or well equipped to make decisions like this in that kind of atmosphere. I think that it's folly. I think that it's a failure of the federal government. I think that it's a failure of the provincial government to just stand by and let them do this. And I think that it's a failure of the municipal governments to entertain it. I would reject it. I would say, like, no, this is a provincial jurisdiction and we're not touching this with a 10-foot pole. This is insane. This is insane. Just because you say it's okay doesn't make it okay. It's insane and it shouldn't be done. Okay, moving into vaccinations. NACI says Pfizer 4-month dosing interval is due to Trudeau Liberals' failure to secure doses. We're the only jurisdiction in the world that is doing this. We're extending the dose by 4 months. Pfizer's recommended dose is first dose and then a second dose within up to 28 days. Now they've said up to 45 days. Quebec was doing 90 days. And then they've increased it to 120 days, which is 4 months. Is that, and with nothing other than the NACI saying, okay, you can do that. And apparently the reason that they said that is because of Trudeau's failure at getting doses. Now, let me be very clear here. Vaccines are a distractionary story. There are places all around the world that have opened up without vaccinations, without green passports, without green passes, without anything like that. We have seen that happening and we don't need them. However, we're playing the COVID game here in Canada, and the COVID game is how many cases, how many people are vaccinated, what's the R number, what's the case number, what's the rolling average over the last 7 days, and it doesn't matter if they don't recalculate it because, you know, they don't recalculate it. They let it lag. They let it lag when it's red, and they don't update it. But it's very interesting that all of these things don't seem to matter. The data does not matter. This is justification, right? This is NACI says we can do this, so we can do this. And it's incredible. Here's Michelle's tweet. She says, I just asked NACI if they would have recommended the off-label usage of the Pfizer vaccine 4-month dosing interval versus 3 weeks. If the Liberals had procured adequate supplies of the vaccine, they answered, of course not. Oh, of course not. And then here's the video of it as well. Watch the head of NACI say the recommendation to extend Pfizer's dosing interval to 4 months wouldn't have been made if the Liberals had procured adequate supply. Like that's a pretty big deal. That's a pretty big deal. And who will be blamed for this? Who will be blamed for this? White supremacist terrorists. Those white supremacist terrorists made Trudeau fail in this one. I can't believe it. I can't believe it. Officials admitted they wouldn't have approved 4-month break between doses had we had enough supplies. Toronto Sun covering Michelle's tweet. And Lloyd Longfield, okay, so this is, for me, it makes it hit home in a way that is not expected, I guess. I would be concerned after seeing news, and I think any thinking person would be concerned about a vaccine when they open the newspaper in the morning and see multiple countries, and it's 12 this morning, had stopped giving out a specific type of vaccine because of concerns of blood clots. I would be concerned. I would be hesitant. I would say, man, we need to think about this. We need to seriously consider this. I would have a hard time towing a party line or having somebody tell me I needed to tweet out about something. And if I had read all of the articles, I would have a hard time tweeting something like this out. I would have a hard time taking a vaccine with those concerns. I would ask the nurse giving me the vaccine, what do you think? I would maybe wait, right? I'm being coy about my choice on the vaccine because it's my choice. I'm not going to publicly state what I'm going to do. And I don't want to influence your choice. It's your choice to make. So I'm being purposely coy about this, but I would have serious concerns about taking a vaccine where multiple countries stopped it due to concerns about blood clots. And I would have concerns about communicating excitement about said vaccine, even if I were excited about it, just because I would want you to make your own mind up, because I would feel terrible if I said, you should go and get this, I'm going to get this, you should go get this. I would feel terrible if you listened to me and experienced a negative outcome, if you experienced an adverse event. And I'll show you adverse events in just a minute, but this is the tweet that I was like, man, I don't understand the thought process behind, because they're people, they're just people. And if you are asked questions, I guess you should answer the questions truthfully, I suppose. But I mean, this is another realm. This seems like towing the party line, this tweet. I'm diatribing too much about this, but I really feel like it's a really slippery slope, and it's a really strange thing to do considering what we know in the broader world at this point in time. So Lloyd Longfield, and he's the MP for Guelph, he says, just like that, Barb and I's wife, I guess, are getting vaccinated Sunday morning. Amazingly fast response by Guelph and Guelph Public Health, Wellington Guelph Public Health, Dufferin, is rocking it as well. It's happening in Guelph, and our city is ready. And then he tags Cam Guthrie, Patty Haydu, Anita Oakville, and then he uses hashtags about washing your hands and stuff. 25 people like it, one person retweeted. So I feel like, again, if you knew that there were concerns about this, if you knew that other countries, like other countries that are that we trade with, that are partners, that are across the table with us about a whole bunch of issues, international fishing and all of that, like we work with a whole lot of these countries that are saying, no, I don't think so. We're not gonna do that. We're gonna suspend that just in case, right? Just in case, to be on the safe side. No safe side here. No safe side, and in fact, like full bore support, full throated, full endorsement, right? Like we're doing it, everyone. Let's go, yay, right? Like lead us off the cliff. It's so frustrating because it's like, if I'm wrong, I'd be glad to be wrong, but I don't think that it's wrong to say let's be cautious when there is evidence that there's a problem, right? It's like if you're driving down the road and you hear a big bang and then your car starts going thump, 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 and then you go, you know what? It's probably fine. I'm not a mechanic, but experts in the car say it's fine. You know what solves this problem? Turn the radio up. I think maybe you might be causing damage that is more expensive than just pulling over and calling a tow truck, man. Nope, we're just going to go faster. Okay, I guess. It's your car, man. It's your car. Head of Canada's National Advisory Committee on Immunization says new guidance on AstraZeneca vaccine for seniors coming soon. Your car, man. Just don't crash it while I'm in it, okay? Can we stop, please? In the last 48 hours, 12 countries, says Warren Yulee. Sorry, I've got that wrong, Warren. He says 12 countries have suspended the use of AstraZeneca, from EU countries to South Africa to Thailand to Iceland. Clearly, it's not a batch issue. If CNAC is politicizing vaccine rollout from 3 weeks interval between jabs to 4 months without consulting Pfizer? Now this? Serious questions. Why are we still driving on this blown out tire, man? Pull over. Pull over. Lots of death in VAERS for COVID vaccine. Okay, what does that mean? What does that mean? I don't know what that meant, right? I thought, I tagged this because I thought that's an interesting stat, but it means nothing. It means nothing. So I went to the VAERS thing, and here's how to access it, right? So it gives you the VAERS Wonder System, and you go here, okay, and this is where I'll take you now, and you click on some things. The reason that I highlighted that tweet is because when I calculated the events ascending, so most events, the third one down was death from the adverse events. So number of vaccine adverse events reporting systems, VAERS results. When I went to I had COVID-19 selected. Let's see if I can see my settings. I'm not sure if I can see my settings. No, I can't see my settings. I can show you my settings. Hold on. Okay, so when you load this up, this is once you get through you have to agree and then click the top one, but it doesn't matter. You can scroll down here, and I added the COVID-19 vaccines, so that includes all of the COVID-19 vaccines. And then I didn't include all events, so that's why it was third from the top. So when you include this grouping, death is third from the top. When you do all events, it's like eighth from the top, maybe more. Death, where are you, death? 12th from the top. 4.25%. Oh no, 3.79%. No, death is 4.25. Yeah. 4.25%. So, oh no, that's in 3.79%, whatever. And when you do it through the selection I made before, death is third from the top with, see, and the number changed. The number changed from what it was before. It was 1,300 before. Anyway, regardless, the number is high and floating at the top, and that's a concerning number, right? Again, if you have all of this data, why the full-throated encouragement? Why the like no qualifiers? Everything's fine. Don't question anything at all. And I mean, like the other things on this list aren't a walk in the park. Right, and there are quite a lot of people who are experiencing, based on these numbers, 20%, 15%, experiencing adverse events. So that's concerning. in my world. That's concerning. It's something that should be talked about. And it's strange that it's not talked about. Something that is being talked about at every level these days is the Green Pass. This is an in-depth tweet thread going through the Green Pass. And I highlighted some. Okay, I was going to say, I think I lost my highlighted things. One, I wanted to show you the CDC, no, the WHO on January 8th, 2020, advised against vaccinating pregnant and breastfeeding women. Due to insufficient data, WHO does not recommend the vaccination of pregnant women at this time. Now, this is January 2020, not 2021, so who knows what their science is saying these days. But as of 2020, the vaccination of pregnant women and breastfeeding women was not recommended. And this is linked here by the WHO. And it goes through, at the beginning, it goes through the what is going on in Israel with regards to Pfizer. And I've been telling you guys about this anyway. The Helsinki protocols were enacted. Israel was... They were saying that having an experiment is not a problem, but telling people that they're being experimented on is necessary for the data to be released to Pfizer. So there was some concern about that. And I feel like I normalized that maybe because this thread makes it into a very big deal. I was reading through it and I was like, well, yeah, when you put it like that, that's terrible. So I'm hoping that I didn't normalize it for people. There's some very big concerns about how Pfizer got access to Israel and was able to roll out this vaccine very quickly. And so basically it's talking about, this guy says, enrolling the Israeli population to become guinea pigs without their knowledge or consent, real world epidemiological evidence collaboration agreement. So there's a lot of stuff, and the reason they wanted Israel was because it was a centralized system that already had a digitized medical record, so they could easily track it, right? So they could easily roll it out. And this is interesting. Remember the cell phone data that I was talking about the other day? It's the same thing that they do with the medical information, apparently. Patient data protection is loosely mentioned only once as de-identified. No further strict data regulations in regards to patient data privacy are defined. Pfizer is not even obliged to run, return or destroy project data or results in case of agreement termination. So there's an interesting thread that is beyond the scope of the show today, but delves deeper into, this guy says that it's a violation of the Nuremberg Code. I tend to agree with him, but I'm by no means a legal expert, and I don't think he is either. But it's concerning where we're going. Where are we going? Well, here's Justin Trudeau in a rare situation where he's saying something that I agree with, and I don't know how this happened, but here we are. Trudeau warns COVID-19 vaccine passports raise questions of fairness. I think they raise more questions than that, but sure, we'll go with fairness. Prime Minister Justin Trudeau expressed caution Friday over the use of vaccine passports, suggesting they could unfairly impact some people if used to decide who can go to a concert or dine at a restaurant. While Trudeau acknowledged that proof of a COVID-19 inoculation would not be out of place for travelers who already face similar requirements for other vaccines when embarking on international jaunts, he said such a scheme for everyday activities in Canada raises questions of equity. He said some Canadians cannot be vaccinated because of medical conditions and noted people who are not prioritized for shots will have to wait much longer than others. Health Minister Patty Haydu noted discussions are underway with international partners about how vaccine passports could be used, but conversations around how passports could be used within Canada are provincial matters, said Haydu, noting provinces already oversee similar vaccination proofs required by some schools and certain healthcare settings. Those are all largely provincial decisions, and of course, they're very difficult ones, she said. But certainly I know provinces and territories are deliberating, about those kind of decisions and are coming their way as more people become vaccinated. Quebec officials said last month that the province was studying the possibility of a vaccine passport, prompting government critics to urge a rigorous examination of the ethical consequences. So, yeah, it's coming, and Trudeau is one of the ones standing in the way. Weird. Be wary of heroes. Sometimes they reverse it on you, right? Sometimes it's a bait and switch, right? Let me be in charge of that. Don't worry, you can trust me. I won't break it at all, right? Keep driving on that blown out wheel. Vaccine and case counts will determine when border opens. So I tagged this because he was talking. Now, we haven't had metrics for anything. They just plunged Sudbury into another lockdown for nothing, for no reason at all. They said variants of concern, case numbers are going up. So they're setting the precedent for being able to do this, and there's no pushback. It moves too fast. Our legal system moves too slow to get a meaningful anything in front of a court at this point in time. Like, we're still waiting for the mask mandate stuff to get in front of a judge, right? And so here we are, right? And so I tag this just to underline that vaccine and case counts determining when the border opens means Trudeau gets carte blanche at opening the border whenever he darn well pleases, and it doesn't look like he wants to open the border anytime soon, regardless of the fact that the United States is getting back to normal. Because the United States is getting back to normal, I think that they don't want to open the border. They have no interest in reopening the border. This one also talks about vaccine passports, and it echoes the same thing that I just talked about in the national news. The other article I had. Anyway, regardless, Canada will not reopen the U.S. border until vaccination rates and case counts reach a level that would make doing so safe for Canadians, says Prime Minister Trudeau. Oh, that sounds so good and so malleable, unmeasurable, such a wide spectrum of success and failure, right? Like you can't really define when it's safe for Canadians. What do you mean safe, right? Like, exactly how safe do you want it to be for Canadians, right? Like, well, I heard that you might get shot in Washington, so we're not going to go there, right? Have you seen Portland? It's not safe in the United States, right? It's not Donald Trump's United States anymore, so maybe it's safer that way, but it's not safe in the United States for Canadians, says Justin Trudeau to open the border, right? So we'll keep it closed to keep you safe, comrade. Okay, we will see what vaccinations look like. We will see what case counts look like. We will listen to experts. Oh, those experts, they know on when we can start easing restrictions. But the safety of Canadians needs to come first, he said. His remarks come in the wake of calls from some U.S. politicians to open the border in time for the start of summer. The border closure has been renewed on a monthly basis, and Trudeau said the renewals would continue. So that's Dad's way of saying, nope, not right now. We're not going to stop for ice cream. Sorry, kids. I'm driving on by. That's the nice way of saying no, right? Maryland is opening up. And I mean, just one more example of Canada ignoring what's happening around the world. And I mean, to be fair, Wales is cracking down, and there's other places that are cracking down too. So it seems to the numbers don't matter. Like they just don't matter. They're going to do what they're going to do. The leadership matters more than the numbers. Dr. Gill says, anyone else growing tired of Aaron O'Toole, Michelle Rumpel's platitudes and deflections? No leadership, no plan. Want to stop harming Canadians, protect our health, save small business, and protect our liberties and freedoms, and all unscientific, unconstitutional lockdowns and restrictions now. Yeah, that'd be nice. MP Derek Sloan says, I couldn't agree more. CPC HQ can't find it within themselves to oppose the vaccine passport, even when the NDP are against them. Shameful. The lockdowns weren't worth it, says the Wall Street Journal. There's a reason no government has done a cost-benefit analysis. The policy would surely fail. Here's Anthony Furey responding to Sean. Sean says, where's the models on the detrimental impacts of lockdowns? Anthony Furey says, when I asked Barbara Yaffe, Dr. Yaffe, about this at press conference the other month, she confirmed that Ontario has not done a formal cost-benefit analysis on the impacts of lockdowns. Well, Wall Street Journal, you might be right. You might be exactly right. This goes through the states that are opening and just kind of breaks apart what I was talking about with regards to places opening and closing kind of arbitrarily. And talking about leadership in Texas opening things up and other places closing. Moving into Toronto and Peel Region will remain in the province's gray lockdown zone, despite calls from the mayors of Brampton and Mississauga to move those areas into the red control zone. So that's great, right? Like, oh, we'll just ignore the local people who want to move things along and keep everyone in lockdown, literally. Toronto has been locked down since October. When is this lockdown going to start working? When are we going to hold people accountable for the fact that it's not working? If you got a plumber and they said, any minute now that pipe's going to stop leaking, I'm working on it. Would you wait 5 months? Right? Like, as your business is closed, as your entire livelihood drives up, as your ability to work is deemed unsafe if you're not vaccinated by bureaucrats who are pushing AstraZeneca despite all of the evidence that's around us, right? Like, and by elected officials who are pushing the same, right? It's crazy. Why would anybody comply with this? Like, like if your plumber says all you have to do is dance in your kitchen and make sure this hula hoop doesn't touch the ground, but you have to be spinning the hula hoop, would you do it? Like, it doesn't make any. Put this over your face, and that'll protect you from COVID-19. Don't worry about the shortness of breath, or the acne around your face, or the impetigo, or the bacterial pneumonia, or anything else. Don't worry about that. Would you do it? Why? Dan Kelly says, while the Ontario government says a region must stay in a COVID color code zone for 2 weeks, CFIB calls on the Premier to support requests by Bonnie Crombie and Patrick Brown to move Peel to red on Monday, allowing small businesses, including salons, gyms, and indoor dining, a tiny pathway to open. Nope. They said nope. Sorry about your luck. Nope. Nope. We're in charge, and you have to comply. And if you don't, well, we'll just keep you locked down further, right? We'll put you in jail. Right. Residents and visitors to Guelph, Wellington County, and Dufferin County will have to put on a mask in more places starting Monday. Oh, let's expand the mask mandate. After I delegated at the March 3rd meeting, they expanded the mask mandate. Genius. The exemptions are still there. If the mask impedes your breathing in any way, you're exempt. I was out yesterday and somebody accosted me in an elevator and he told me that I wasn't allowed to be in the building if I didn't have a mask on. And I just looked at him and then I walked away. I was like, I'm not even going to waste my breath on you, man. I'll see you later. Like, I just walked away. Went into another elevator, which opened at exactly the right time, and I left. And I was like, and then I think he was with a girlfriend or wife or something like that who came into the elevator after I walked out, and he was like, that guy's not wearing a mask. Like, it was so incredulous. He was like, what? I can't believe it. I thought it was more funny than anything else. And then I was kind of sad about it because I was like, everybody has bought into this insanity. Everybody's bought it. Everybody's hula hooping in their kitchen saying, no, you don't understand. We just can't let this hit the ground and the plumbing will be fixed. It will. It'll be fixed. He said so. I would expect us to need to have to close schools as an important measure. Some Toronto university professor who teaches and has a dabbling interest in this said that, and Toronto News decided to run with it. People weren't happy with that. This is a smaller tweet, but the initial tweet with this had a lot of people saying, like, this is not accurate. You're lying. I think they are. I really do. I think they are. Here's Anthony Fury. Third mass school closure likely for Ontario due to coronavirus variant spread, Toronto epidemiologist says. Anthony Fury says, this story is nonsense and completely offside from what pediatric experts are saying. But Ontario parents should nonetheless be prepared to battle leading into the April break week, as there will be others who try to use it as an opportunity to keep schools shut much longer. Canadian pediatric experts actually say schools should be kept open, even if cases surge and rising community transmission is not an excuse to close them. Yeah, but again, the cases don't matter. Nothing matters other than the narrative and the timeline that was pushed in October, because that's exactly what we're following. The UBI, I'll show you. There's a UBI. There should be a UBI thing. Hold on, let me see where that is. It's coming up, I'm sure. Yesterday, Anthony Fury says, I asked Ontario's Dr. David Williams if it's fair to assume that children's outdoor sports would get greenlit this summer. Instead of directly answering the question, he mused about when vaccines will be available for kids. Utter madness, one pediatrician expert said to me. Yeah, the vaccines aren't... The vaccines aren't tested for kids, as far as I know, under 12 anyway, and under 16 in a lot of instances. So they're not the target group, really. They're not a target group to be protected. So it's incredible to see what's happening despite the evidence, right? Despite what's actually happening on the ground, we're lumbering forward anyway, right? Like the idiot in the corner leading us with the paper bag over his head. Yeah, that's him. Okay. Anyway, a couple of weeks ago, I reached out to Ontario. This is John Mark Benoit. He's an MD. He says, a couple of weeks ago, I reached out to the Ontario NDP leader, Andrea Horvath, re concerns about Peel District School Board child quarantine rules. Peel District, not School Board, Peel District's child quarantine rules. Having received no reply after 2 weeks, I released the email in hopes maybe it will get seen on Twitter. So I retweeted this, but I think it's worth reading. John Mark says, or Dr. Benoit says, I hope this email finds you well. It's come to my attention that quarantine rules for children who have been exposed to potential cases of COVID in the Peel District overlap with the definition of child abuse by isolation. I've reached out via Twitter to Minister Todd Smith, Minister of Child, Youth and Community Services, with these concerns. Twitter has become one of the primary ways that I carry out my duties as a physician who supports the health of Ontarians during the pandemic. It seems to be a useful way to share concerns and information regarding the pandemic, and I've received several individual messages of thanks by Ontarians for my work there. Given that I've received no reply from the Minister Smith via Twitter after 48 hours, during which time his account has been posting regarding other matters, can your office assist me in obtaining a reply from Minister Todd Smith? So this doctor is doing kind of what I try and do: find the person who can actually get you in touch with the person whose job it is to deal with this, and actually tell them directly there's a problem here. I've been trying to tell Mr. Lisi there's a problem with his school boards for a while, but he doesn't care. He doesn't get back to me. Somebody said that he had two portfolios. I didn't know that. I don't know what he's also minister of. He's Minister of Education and something else. Let me know in the comments. I really don't know. I'll maybe look it up. We'll see. I'm busy. I've got things to do today. But I think that it's interesting that this is a problem across most government, provincial and federal. I have to say municipal, not so much, although I send messages to municipal people and I don't get responses back. But it's often in group emails, and often I get referred to the chair. Like the chair of the board has to respond to me, but I send it to all the members of the board because I want them all to know what I've sent, because I think that that's important. Let's all be discussing this. Let's all have a discussion. Let's all be on the same page discussing the same data. That's how I feel about it. But anyway, regardless. Peel Public Health orders Amazon Canada to close all shifts at Brampton facility. Peel Public Health has been working closely with Amazon Canada to get this outbreak under control. This order will allow Amazon Canada further time to consider additional operational charges. Workers will have to self-isolate for 2 weeks effective 12/01, March 13. Can you imagine, like, just because you work in a factory at Amazon or a warehouse in Amazon, you have to quarantine for 2 weeks because Peel tells you to? Like, this is welcome to Brave New World, man. This is now the noose. You can feel it. It's right there, and it's tightening too. So I don't know people who can't feel it, people who don't see it. People are like, it's fine, it's fine, it's fine. I don't know how to tell them more clearly that this is bad. I don't know how to tell them more clearly that this is. Every indication says that fighting this ends up with you losing. Really. I wish I was wrong. I hope I'm wrong. I hope collectively everybody wakes up and says, this is crazy. Right? Sudbury, Ontario, starting last week, they tripled COVID testing. And what do you know? Tripled the positives, false positives. Now what? We've re-entered lockdown with 12 hours notice. All the orchestrators are receiving full pay, but your businesses cannot be open. Okay, this is some SciGen stuff, and people are angry, people are upset. Ultimately, I think that when you have to have a difficult conversation with somebody, sometimes that person will cry, sometimes they'll get angry. But these are deflectionary reactions, right? Like, you always do this, let's fight about the toothpaste again, right? Like, or whatever. They won't engage with the actual thing. They'll try and push you off of it because they don't want to actually engage with the actual thing. And I feel like we're seeing that from our government a little bit, right? Like, that's what we're seeing from our ministers. It's interesting. Defense Minister Harjit SciGen plays the race card in denying he's friends with former CDS Jonathan Vance. Quote, I've had many people, many white men, tell me what my experience is. I would go after anyone regardless of rank or position if allegations were brought forward. SciGen says allegations of sexual misconduct against top military commander came to him 3 years ago. Defense Minister says he did not review the evidence, suggested watchdog investigate. Very interesting. Here's Mercedes Stevenson saying, I can't ever recall seeing Minister SciGen this angry before. He's very upset and says that our garrison tried to define his service in the CAF. I tagged this because I wanted to find out like what the fight was about. And all I found was basically like stuff about different arguments regarding SciGen and different people telling him, well, here's one. The one thing Mr. Trudeau never seems to have told Mr. Sajjan is that he's the minister responsible for national defense and that he should act like it. Yeah, okay. Global asked the minister's office if political staff in the office were aware of Lieutenant Commander Trotter's phone call. We also asked if the minister was briefed. We did not receive any answers. The minister's office said at no time did any staff in the office of the minister speak to the caller, but nothing further about whether they were aware of the call or who made the decision to redirect the call to civilians at the Department of National Defense. So here's, I think, what they're talking about with regards to the Trotter call. Oh, hold on. It was highlighted. The Trudeau government and opposition Conservatives marked International Women's Day today by trading barbs and accusations over reported threats against a senior naval officer who brought forward an allegation of misconduct against Canada's defence chief. The bitter back and forth came as members of the House of Commons Defence Committee agreed to invite new witnesses to testify in an expanded probe of the Liberals' handling of allegations against the military's top brass. The list of new witnesses includes top Liberal officials as well as 2 former aides in the previous Conservative government. It also includes Lieutenant Commander Raymond Trotter, who reportedly flagged an allegation of misconduct by Chief of Defence Staff Admiral Art MacDonald last month. Global News has reported Trotter subsequently received 2 threatening phone calls from blocked numbers, one from a person claiming to be a military officer and the other from someone who identified themselves as a senior member of the Canadian government. The callers allegedly warned Trotter against cooperating with the Commons Defence Committee's investigation and said that his military career would be over if he did. In response, Conservative defence critic James Bazin and fellow Tory Pierre-Paul House and Leona Alislev released a statement Monday accusing the government of having undertaken a coordinated campaign to threaten and silence a sexual misconduct whistleblower. So it's all yeah, like this is back to Sajjan, right? Baseless accusation from the Conservative Party harms confidence in the process that exists to help those who come forward with complaints of misconduct. This reckless insinuation only serves to create doubt for those who step forward and those considering it. So I don't know. I don't know what's going to happen with regards to Sajjan and Trudeau. I don't know what's going to happen with regards to the whistleblowers and their years-old complaints. I don't know what's going to happen with regards to any of it. It seems like everything has been swept under the rug for the last few years. Really, it seems like everything has just been like, don't worry about it, man. Don't worry about it. It's cool. We've got this. We've got this. Please ignore the blown-out front tire while I accelerate through this slide, and everything will be fine. Make sure your seatbelt's on, right? The last story for today. I could have ended it there. That would have been pretty good. But anyway, the last story for today. 800,000 Canadians will be locked out of their Canada Revenue Agency online account until they change their login credentials after identical information was found for sale on the dark web. Yowza. Right? Yowza. Do you trust this government to have all of your medical information in a handy digital package ready for you to accept your digital tracking vaccine? I mean, your digital COVID vaccine? I mean, your just regular COVID vaccine that's definitely normal and you should definitely not question anything concerning about it at all. And if you do, you're probably a terrorist. Right? Do you trust them? Because they've done such a good job so far. Haven't they? Haven't they? Why wouldn't you trust them? Why wouldn't you trust them? Okay, that's enough out of me. Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, check out SpeakingMoistly.co, and have a wonderful, wonderful day.